Welcome back to the RMS Experience, where we highlight the incredible people behind our remote medical staff. Today, we're joined by Madel, who works in authorization. She plays a crucial role in making sure patients receive the care that they need without delays. Madel, welcome to the podcast.
Oh, hi. Hi, Jana.
How are you?
I'm good. I'm
That's
good.
good to hear. Okay,
Yeah.
before we dive into your role, can you tell us a little bit about yourself and where you're from?
Okay. So my name is Madel Santiago, and I am from Las Piñas City, Metro Manila, Philippines, where I currently reside. So I am 38 years old now, married, and have a 15-year-old son. Additionally, I have an 8-month-old pet cat named Loki. So I have passion for singing and dancing, and I'm also an avid cat lover. So, I graduated from Pamantasan ng Lungsod ng Maynila with a Bachelor of Science degree in psychology. So, upon graduating or upon completing my course, I entered the industrial field of psychology, initially serving as a recruitment staff in the human resources department of an insurance company. And then after that, I transitioned to roles as marketing officer um, in a in an investment company and a retail shopping company. And then in 2011, I began working remotely, which provided me with the opportunity to collaborate with Dr. Yu in 2015. And then most recently in 2022, I assumed the role of RMS at MSO MSK, where I took the responsibility of being a lead authorization specialist.
Okay, thank you so much for letting us get to know you. And it's so great to have a fellow Filipina on the RMS team. So let's talk a little bit about your role. Can you explain to the audience what authorization is and why it's such an important part of healthcare?
Sure. So, authorization or prior authorization is a process used by health insurance companies to determine if they will cover a prescribed procedure, service, or medication. So it has an approval requirement that before a healthcare provider can proceed with a certain treatments or medications, they must obtain an approval first from the insurance company, of course. And then the main goal is to ensure that the proposed service is medically necessary and cost effective. And then without the prior authorization approval, so the insurance company may not cover the cost, then leaving the patient responsible for the full expense.
Okay, thank you. For you, what does a typical day look like for you on in authorization?
Okay, so typically in a day, I manage actions in ECW under the authorization department. My primary responsibility is to submit authorization requests to insurance companies. And then we utilize three or some methods for submitting these requests. So number one is insurance portal. Then number two is via fax if no portal is available. And then the other one is via email. So when an authorization is submitted through the portal, I check the status after 3 to 5 working days to determine if it has been approved or not. So for authorizations submitted via fax, I will follow up by calling the insurance company to inquire about the status. And then if it's via email, so I follow up through email, and if necessary, make a phone call if there's no response. And then once I receive the status of the authorization, if it's approved, then I proceed to sending the fax or faxing the order or referral to the appropriate facility or provider. And then after that, I inform the patient of the approval via email, text, or phone call. So if the authorization is denied, then I follow the instructions outlined in the denial letter to work towards obtaining the necessary approval.
So it does sound like a fast-paced role with a lot of moving parts. So can
Ye-
you share with us an example of a time when your work made a big difference for a patient or a provider?
Oh yeah. So one instance is that stands out, I think, um, is when I was handling an urgent authorization request for a patient who needed a specialized diagnostic test or diagnostic radiology. So the initial request was submitted through the insurance portal. Then after the standard 3 to 5 days of uh, the usual waiting time, it was still pending. So given the urgency, I proactively followed up with the insurance company via phone and email to expedite the process. So despite my efforts, the request was initially denied due to missing documentation, and I quickly coordinated with the patient's healthcare provider to gather some necessary information and then resubmitted the request. So I continue to follow up persistently, ensuring that the insurance company had all the required details. Thanks to I think efforts and was the help given to me by my colleagues in the clinic department, the authorization was approved and ensuring that the test will proceed as planned. Then I immediately informed the patient and the healthcare provider to ensure that the test will be done or will be completed. And then the family or the immediate family of the patient were grateful, and the healthcare provider appreciated the swift resolution, which ultimately made a significant difference in the patient's care and diagnosis.
Well, thank you so much for sharing that wonderful experience. And thank you for helping us get to know the authorization department and all the effort that goes behind the seamless um, things that go beyond there. So, for before we wrap up, do you have any advice to give to someone who wants to work in authorization?
Oh, sure. So here are the advices that I think I can offer. So when you're working with authorization departments, so attention to detail is very important. So it's accuracy, most importantly, is very crucial for the role. So we should always ensure that the documentation is complete and correct before submitting. Otherwise, the authorization will get delayed or denied. So number two, I think, is we should have a strong communication skills. It is very essential so we can effectively communicate with the insurance companies, the healthcare providers, and the patients. So there will be a smooth processing of the authorizations. And then number three, I think, advice for being a persistent to follow up, because we should always be proactive in following up in about the pending requests. So timely follow-ups can make a significant difference in getting approvals and providing necessary update to the patients. And then we number four is, I think, we should familiarize ourselves with the policies of the insurance companies about their requirements. If this test or referrals is or are very needed other requirements for it to become approved, to have it approved. So the process will be more efficient. And then I think the last would be we should know that working in an authorization department or doing authorization can be challenging, especially with dealing with urgent matters, especially when it's urgent and then it gets denied. So maybe the approach is like we can give empathy and patience, so we can understand the impact of our work and the impact of it on patients' lives. That's it.
Yes, those are really great advices. Thank you so much. And thank you for joining us today, Madel. It was great learning about all the important work you do in authorization. And to everyone watching, I hope you stay tuned for more RMS interviews. Don't forget to like, comment, and subscribe to support the series. See you on the next one. Thank you.
Thank you. Bye.